Making headlines this hour, President Dr. Mohamed Muizzu calls on Maldivian writers to uphold truth, patriotism, and national values in their work, saying writers should produce work that brings honor and distinction to the country. Ministry of Health, Family and Welfare Gila Ali announces the government has begun work to establish the Maldives' first facility for conducting post-mortem examinations. And Minister of Education, Higher Education and Skills Development declares that no child will be allowed to remain out of school, underscoring that the issue demands urgent concern from all stakeholders. Bismillahirrahmanirrahim. Assalamu alaikum and welcome to PSM News in English with me, Fatma Zaina Rifat. And now for the news in detail. President Dr. Mohamed Muizzu calls on Maldivian writers to uphold truth, patriotism, and national values in their work, saying writers should produce work that brings honor and distinction to the country. In a post shared on social media, President Dr. Mohamed Muizzu extended his congratulations and best wishes to all Maldivian writers and the public on the occasion of the Maldives' 34th National Writers' Day. The president said that the noble religion of Islam encourages education, the dissemination of truthful information, and the advancement of writing and literacy. He therefore advised everyone who writes in the Divehi language to promote truth, communicate with courtesy, and share positive ideas and reflections that will benefit both present and future generations. President Muizzu said that Maldivian writers should be trustworthy, patriotic citizens who write in ways that will always make the nation proud and enhance its reputation. National Writers' Day in the Maldives is observed because of the country's first magazine that was published on 8th July 1933. The publication was called Al-Islah. However, the day was officially recognized and first commemorated nationwide on 8th July 1993. Looking at Maldivian history, writers have played a responsible and significant role in the development of the nation. Religious scholars have contributed through Islamic scholarship, literary scholars through literature, and historians through historical writing. Journalists and political figures have also made important contributions in their respective fields. Minister of Arts, Culture and Heritage Hina Walid describes Divehi writers as key contributors to preserving the country's cultural values and strengthening national identity. In a message issued to mark National Writers' Day, the minister noted that through the scholarly writings of Al-Islah, writers helped to awaken the nation, while the creativity fostered by Wahaka Committee encouraged a culture of reading among Maldivians. She said that writers have embedded civilized values and a sense of national identity in the minds of Divehi children. She added that every writer has fulfilled the trust and responsibility embodied in a call to be a trustworthy writer. The minister also expressed her hope for the continued growth of Divehi literature and called for further efforts to promote reading in the Divehi language. National Writers' Day is observed in the recognition of the important role writers play in safeguarding public morals and advancing the progress of the nation. It also serves to honor their contributions to the development of the Divehi language and literature to encourage the emergence of new writers. Writing remains one of the most important means of preserving a language and fostering enlightenment within society. Through writing, traditions, culture, the values of national identity are passed from one generation to the next. Minister of Health, Family and Welfare Gila Ali says although the establishment of specialized treatment services for major illnesses in the Maldives has reduced the number of patients sent overseas for medical care, the savings have not been reflected in overall expenditure because significant costs are still incurred for sending cancer patients abroad. The minister made the remarks in response to a question from Gallaru North parliamentarian Mohammed Ibrahim during a sitting of parliament regarding the government's long-term strategy to reduce spending on overseas medical treatment. Minister Gila said government spending on healthcare should be viewed not simply as a financial cost, but as an investment in building a healthier population. She said the government had expanded a range of specialized medical services in recent years so that treatment for major illnesses could increasingly be provided within the Maldives. As a result, the number of patients traveling abroad under the Asanda health insurance scheme declined over the past 3 years. Between 2023 and the end of 2025, the number of patients sent overseas fell by 338. However, she said the overall reduction has been limited because of the number of patients requiring overseas treatment for cancer has continued to increase. She added that 1,638 people traveled abroad for cancer-related diagnostic tests in 2023, 1,996 in 2024, and more than 2,000 in 2025. These figures include patients who traveled repeatedly to receive treatment. The minister said the government's primary objective is to establish these specialized services within the Maldives, adding that steady progress has already been made. She said mammography services for breast cancer screening have been introduced in Malé and in the atolls, enabling around 750 people to undergo testing within the country so far. Work is also underway to expand the service to 3 additional atolls. Efforts are also continuing to extend cervical cancer screening services nationwide. Minister Gila said that despite the availability of chemotherapy services in the Maldives, only 39 patients sought the treatment abroad last year, while 655 patients received chemotherapy locally. The minister added that once the planned cancer hospital, PET scan services, and radiotherapy become operational, the need to send patients overseas for these treatments will be significantly reduced, making cancer care more accessible and convenient for Maldivians. Minister of Health, Family and Welfare, Gila Ali, announces the government has begun work to establish the Maldives' first facility for conducting post-mortem examinations. Responding to a question from parliamentarian for Gallaru North constituency, Mohammed Ibrahim, the minister said the government was frequently required to send bodies abroad for post-mortem examinations, despite there being no legal impediment to conducting them domestically. The parliamentarian had sought clarification on why the service was not available in the Maldives and whether there were plans to introduce it. The minister said that in collaboration with relevant authorities, the Malé City Group of Hospitals, MCGH, is now working to establish the Level 2 medical unit. Once operational, the facility will provide clinical, forensic, medical, legal, and post-mortem services not only to the Greater Malé area but to the entire country. She noted that the unit would pave the way for the provision of such services within a robust institutional framework. She added that land for the facility has already been secured. The unit will also provide services to assess injuries sustained by victims of violence and persons in custody, as well as determine the extent of injuries for legal and insurance purposes. The minister said the unit will enable forensic examinations to determine causes of death in cases requiring legal investigation, as well as the investigation of sexual and physical assault cases. Although legislation governing post-mortem services was enacted in 2015, successive governments did not establish the service. The current administration, she said, is now taking the necessary steps to introduce it properly in the Maldives. Before the unit becomes operational, forensic pathology regulations will be finalized and published in the government gazette. The minister stressed that special attention is being given to ensuring public confidence in the service. Over the past decade, 23 bodies have been sent abroad for post-mortem examinations. Each examination cost approximately $3,567.44 US. Minister of Health, Family and Welfare, Gila Ali, says the measles situation in the Maldives remains under control, with measures continuing to prevent further transmission. Responding to a question in Parliament, the minister said although measles cases have been reported in the Maldives since May, the majority have been detected in the Greater Malé area. She said that while measles is highly contagious, the current situation has not reached an uncontrollable level. The minister said that she would provide Parliament with a more detailed update on the measles situation separately. Gila said the high vaccination rate in the Maldives has significantly reduced the risk of widespread transmission. She noted that around 99% 50% of the population has been vaccinated against measles, helping to minimize the severity of infections and making treatment more manageable. Addressing concerns raised by opposition parliamentarians over the alleged shortage of measles testing kits, the minister said testing is available at health facilities across the country, including those in Male. She said testing kits remain available at all centers, adding that while shipments from overseas may occasionally be delayed, the country has not run out of testing supplies. Since the first measles case was detected in May, 121 people have tested positive for the disease. Of those, 55 cases were reported during the past week. The Health Protection Agency, HPA, is continuing contact tracing and testing while also administering vaccines to people considered at risk. 5,495 people have been vaccinated against the measles so far, according to the HPA. The ministry has urged the public to seek medical attention immediately if they develop symptoms, such as fever, a red rash, cough, a runny nose, or red eyes. It is also advised anyone who has been in contact with an infected person to inform the relevant health authorities, while urging people with weakened immune systems to ensure they are fully vaccinated. As part of the response to the outbreak, special arrangements have been made for patients seeking medical consultations at Indira Gandhi Memorial Hospital, IGMH, and Hulumale Hospital. Work is also underway to establish an isolation facility in Hulumale. The United Nations Children's Fund, UNICEF, donates 28,000 doses of the measles rubella MR vaccine and medical equipment to support the Maldives' response to the ongoing measles outbreak. The donation was formalized during a ceremony held at the Ministry of Health, Family and Welfare on Wednesday. The assistance agreement was signed by Minister Gila Ali on behalf of the government, while UNICEF was represented by its resident representative to the Maldives, Dr. Edward Adai. Speaking at the ceremony, Gila said the donation would provide a significant boost to efforts to contain the current outbreak and reflected the strong partnership between the Maldives and UNICEF. Gila said more than 5,400 people have been vaccinated since the immunization campaign began. She added that laboratory testing capacity has been expanded and contact tracing efforts intensified as part of the national response to the outbreak. The minister also thanked healthcare professionals for their continued efforts in responding to the spread of the disease. She urged anyone eligible for vaccination to come forward, describing immunization as an important step in protecting individuals, their families, and the wider community from measles. The UNICEF donation follows a separate contribution from the Government of India, which recently provided 20,000 doses of the measles vaccine and 3 tons of medical supplies to support the Maldives healthcare services. Since the first measles case was detected in May, 121 people have tested positive for the disease. 55 of those cases were reported during the past week. The Health Protection Agency, HPA, is continuing contact tracing, testing, and vaccination of people at risk. According to the HPA, 5,495 people have received the measles vaccine so far. Dr. Ismail Shafiu, the Minister of Education, Higher Education and Skills Development, declares that no child will be allowed to remain out of school, underscoring that the issue demands urgent concern from all stakeholders. Approximately 8,000 children fail to attend classes on a daily basis, the minister revealed on 30th June during a ceremony held to release the key Stage 3 2025 National Assessment of Learning Outcomes report. 40% of these daily absences are concentrated among students enrolled in schools across Male, Vilimale, and Hulumale. Minister Shafiu explained in response to a parliamentary inquiry regarding truancy rates that strict enforcement of student attendance monitoring was initially implemented by administration that took office in 2013, but the subsequent government failed to adequately maintain the effort. While the ministry possesses an existing policy dictating protocols for absences, officials have enacted new measures to strengthen oversight, mandating that schools share attendance data with the ministry on a daily basis starting 21st June. The minister underscored that this matter necessitates attention from parliament members, parents, and teachers as a child's absence impacts the nation's human capital development. He noted investigating the underlying reasons for such absences remain critical, observing that current trends are not driven by health conditions. Having met with principals in Malé region to mandate disciplinary measures, he asserted that the administration remains committed to ensuring no child is permitted to remain out of school. Under previous regulations, schools were only required to submit reports once an absence reached 3 days. Structural policy changes now ensure attendance rates are assessed and evaluated on a daily basis. Fishing activity begins to recover following a sharp seasonal decline in recent weeks, with the Maldives Industrial Fisheries Company, MIFCO, now purchasing an average of 50 metric tons of fish per day. MIFCO said catches are expected to increase further in the coming days as fishing conditions improve after the slowdown experienced during June. The state-owned fisheries company said that the most productive fishing grounds are currently around Laviani Atoll. The recent decline in the fishing activity was reflected in the amount paid to fishermen for their catch. According to MIFCO, fishermen received $732,814 in June, the lowest monthly total recorded so far this year. In comparison, payments reached a peak of $5.11 million in April. Payments made to fishermen during the first 6 months of the year were $2.61 million in January, $1.32 million in February, $1.9 million in March, $5.11 million in April, $2.01 million in May, and $732,814 in June. MIFCO attributed the decline to reduced fish abundance in Maldivian waters during the southwest monsoon. The company said fishermen received an average of less than $64,851 per day in June, while on some days payments for landed catch fell to around $12,970. However, MIFCO noted that this is not unusual. Historical fishing data shows that June and August are traditionally among the slowest months for Maldivian fishery. During the southwest monsoon, rough sea conditions and lower fish availability typically result in reduced catches every year. The company said catches have now started to improve following the seasonal slowdown in June. According to MIFCO, it said purchases are currently averaging 50 metric tons per day, with volumes expected to increase further in the coming days. At present, the most productive fishing grounds are around Laviani Atoll. Despite the seasonal downturn, MIFCO recently increased the price it pays for fish after the United Kingdom removed tariffs on Maldivian tuna exports. Since 9th June, the company has been purchasing fish delivered to its collection centers at $1.29 per kilogram. The S&P 500 ends lower, weighed down by losses in Micron Technology and other chip makers due to mounting doubts about the sustainability of Wall Street's AI-driven rally. Chip stocks in Asia and the United States dropped after memory chip giant Samsung Electronics' blowout earnings report failed to satisfy investors with sky-high expectations. Micron and SanDisk both fell, pulling the Felix chip index lower. Adding to worries about high-flying chip makers, Reuters reported that Chinese startup DeepSeek is developing its own AI chip, a push that could reduce its dependence on NVIDIA and Huawei chips. The S&P 500 lost 33.58 points, or 0.45%, to end at 7,503.85 points, while the Nasdaq Composite lost 302.47 points, or 1.16%, to 25,818.69. The Dow Jones Industrial Average fell 130.76 points, or 0.25%, to 52,925.15. Tuesday's chip sell-off marked the latest bout of volatility among memory chip makers and other AI-related stocks, as investors worry that sharp gains related to the build-out of AI data centers may have left the shares too pricey. The U.S. Central Command says that it had struck over 80 targets during its latest strikes on Iran, including Iranian air defense systems, coastal radar sites, and anti-ship missile capabilities. Reuters was not able to independently verify the location and the date when the video was filmed. No earlier version of the video was found posted online. Iranian media reported explosions early Wednesday local time on Iran's main oil hub of Khag Island, on Qeshm Island, and in the southern port cities of Sirik and Bandar Abbas. According to an Iranian state TV reporter, no civilian deaths were reported, but several people were injured by shrapnel from an enemy projectile that hit a commercial pier in Sirik. Iran's top joint military command, Khatam al-Anbiya Central Headquarters, said on Wednesday that Iranian armed forces would deliver a crushing response and warned that Tehran would not allow U.S. interference in the management of the Strait of Hormuz. Antoine Griezmann said he had fulfilled a lifelong ambition by joining Major League Soccer club Orlando City, with the former France forward excited to live in the United States. The 35-year-old joined Orlando on a contract through 2028 after leaving Atletico Madrid as the club's all-time leading scorer, saying he had dreamed of playing in the MLS since he was 18 and wanted to arrive while he still felt physically and mentally capable of performing at his best. The World Cup winner added that he hoped his experience would help Orlando compete for trophies, while jokingly wishing Lionel Messi would only win the World Cup Golden Boot and Kylian Mbappe the World Cup trophy. A nearly 38-foot Tyrannosaurus Rex skeleton named Gus heads to auction at Sotheby's in New York, with a pre-sale estimate of $20 million to $30 million. The mounted skeleton from the late Cretaceous period, about 67 million years ago, was discovered in the Hell Creek Formation in Harding County, South Dakota. Gus is approximately 61% complete by bone count, with 183 fossil bone elements and 30 gastrula, or belly ribs, according to the auction house. The skeleton measures about 38 feet in body length and rises 12.5 feet tall. Its skull is about 54 inches long and about 82% represented, including all 6 tooth-bearing jaw elements. Sotheby's says it also has rare upper forelimb bones, a rare furcula, a complete pelvis, and substantial fossil material from both feet. Gus was excavated over field seasons in 2021, 2022, and 2023 on private land owned by the late Gary Gus Licking, a cattle rancher in Harding County. The fossil was named in his honor. Hatton said the sales include copyright, giving the buyer rights connected to reproductions. Sotheby's Natural History Sale is part of Geek Week 2026, which will feature 3 live auctions from July 1st to July 15, spanning natural history, space exploration, and the history of science and technology. And that's all the news we have today. Thank you for watching PSM News.